Welcome to Emergency Insights. I'm James Carter. Today, we're focusing on traumatic brain injury, TBI, a critical topic for healthcare providers on the front lines. Let's start with TBI classification. Severity is based on the Glasgow Coma Scale, or GCS. A score of 13 to 15 indicates mild TBI, 9 to 12 is moderate, and below 9 is severe. Mortality rises sharply with severity. Mild cases have low risk, but severe TBIs carry up to 40% mortality. The GCS isn't just a label, it's a key predictor of outcome. A drop in GCS score, even from 15 to 14, significantly increases the chance of serious intracranial injury and may indicate the need for surgical intervention. In the emergency setting, CT is the imaging modality of choice. It's fast and effective in detecting skull fractures, hemorrhage, and contusions. For mild head trauma, CT is warranted in cases with prolonged loss of consciousness, disorientation, abnormal neuro findings, seizure, repeated vomiting, or high-impact injury mechanisms. MRI, while slower, is more sensitive for subtle injuries and chronic changes and helps differentiate hematoma types and assess deeper brain damage. Management of mild TBI is mostly supportive: rest, pain control, and gradual return to activity with close monitoring for worsening symptoms. For moderate to severe TBI, immediate stabilization is critical. Priorities include airway protection, monitoring intracranial pressure, and maintaining cerebral perfusion. Surgery may be required for hematoma evacuation or pressure relief. TBI often comes with other trauma. Cervical spine injuries occur in up to 12% of blunt head trauma and must be ruled out early. Skull base fractures, often accompanied by CSF leakage, are seen in about a quarter of cases. Ocular injuries also need attention, especially when intracranial pressure is elevated. In pediatrics, abusive head trauma should always be on the radar, especially in infants. It often lacks a clear history and requires high suspicion. Look for inconsistent explanations and perform imaging and skeletal surveys to uncover hidden injuries. MRI helps identify subtle or chronic findings that CT may miss. Lastly, let's review common CT findings in mild head trauma. Soft tissue swelling is relatively common. Skull fractures and intracranial hematomas, especially subdural and epidural, are significant and must be promptly recognized. Less common findings include subgaleal hematomas, brain swelling, and contusions, each guiding different management pathways. That wraps up today's Emergency Insights. I'm James Carter. Thanks for joining me. See you next time.